This is the era of true partnership. Yeah.
Daniella, Shalini, welcome. Daniella, your industry is changing so fast. So where are you putting your focus right now? What are your priorities?
So one of the things that I'm thinking a lot about is where the consumer is going. And one of the things that we see clearly is that individuals are more interested in their own personal health than ever before. We're fundamentally at a key point of transformation. And what we're seeing is that individuals want agency over their health and they want to be the CEO of their own health.
Yep.
So this is where things like science-based self-care, prevention, health education and literacy, digital tools become so central to not only serving consumer needs, but ultimately keeping them healthy at a time when we know hospital and health systems are also under strain.
Shalini, does that resonate with you? You speak to leaders all the time in this space. What are they saying to you?
It resonates a lot, actually. I think a lot of companies are thinking about, in this age of volatility, but where volatility is the norm, how do you drive growth? And there's these three kind of, I would say, undervalued levers to drive growth. One is, how do you drive resilience in your business? One is, how do you drive innovation? To your point around consumers are demanding something new, but the innovation has stagnated for a long time. And so how do you drive innovation to get to that? And the third really is societal impact and sustainability. And these three are really connected to each other and can really be through AI, can really help drive growth in an era of volatility.
I want to drill a little bit more into that societal impact. You said doing good for the sake of doing good, but actually now it's a driver of growth. Where will that take us?
I think it will take us to a place of greater impact. But I think corporations have an enormous ability to drive massive societal impact, especially when it's close to their business. And the ability to find ways to drive resilience. If you take the agricultural value chain, livelihoods for farmers, livelihoods for those along the journey, the health of the consumer, are all in line with ways in which a corporation can add value to society and drive business value.
And I would also say that they're interconnected.
Yeah.
So I think about these in terms of kitchen table issues. You know, what are the things that people are talking about? They're talking about their personal health. People want access to clean water. They want access to food. So these are these basic things. If you talk about resilience and we think about the moment we're in now with AI and the fourth industrial revolution, well, that has to be powered by energy and natural resources. And those all have supply and value chains. And in many cases, they're also interconnected. Yeah. So another key piece of this that I've observed over the last 12 months is this is the era of true partnership. Yeah. So gone are the days where like one company says, oh, I want to go in and just focus on resilience on my own or just focus on sustainability on my own. We're now moving into the phase of we're beyond pledges, we're beyond just ambitions. It's about execution. And to really execute and get things done, you have to start thinking about systems and the ecosystem that you operate in.
How important will partnerships be, Shalini?
In this moment with AI, it's an opportunity to reimagine. And when we reimagine all of the things that in the past we said, well, it's because we did it this way, we have an opportunity to reimagine from the community, a much more collaborative value chain, value created along the way for everyone. And I want to stay optimistic and believe that that's possible.
I love that because I think we're in the midst, we do hear a lot of doom and gloom, right? We're in a highly ambiguous environment right now, and that's the new norm. The opportunity in all of that is what I would call the great reimagining. Yeah. And I see this every day in health. We have never been in a more exciting time for health from a scientific, technological, innovation perspective. And at the same time, a more challenged time in terms of the strain that health systems are under. And this is where things like science-based self-care, prevention, and aligning the incentives to the outcomes become critical. And I'm seeing innovative models that are doing it, whether it's things like health impact bonds or unconventional partners coming together to say, hey, we actually want to reward the results and the outcomes versus just the inputs. And that's going to be critical.
How's that for some optimism?
That is fantastic. Thank you both, Daniella, Shalini. Thank
Of
you for
course.
joining
Thank you,
us.
Georgie.
Thank you for having us.